What if you could reduce anxiety and depression without medication, just by learning to pay attention to your breath? Every day, millions of people around the world are discovering the power of mindfulness, a practice that's been around for thousands of years but is now backed by science. It's not a quick fix, but it's transforming lives, one moment at a time. Today, we're diving into the world of mindfulness, exploring how it works, why it helps, and what the research really says. Mindfulness is more than just a buzzword. It's a way of being that teaches us to notice our thoughts, feelings, and bodily sensations without judgment. It's about grounding yourself in the present, rather than getting lost in worries about the past or fears about the future. This simple shift in awareness has been shown to calm the nervous system, reduce stress, and even change the structure of the brain. But how did it all begin? And why is it suddenly everywhere from yoga studios to corporate offices? The roots of mindfulness stretch back to ancient Buddhist traditions, where it was a core part of meditation practice. Over the past few decades, scientists have taken a closer look at its effects, leading to the development of structured programs like mindfulness-based stress reduction, MBSR, and mindfulness-based cognitive therapy, MBCT. These programs, pioneered by researchers like John Kabat-Zinn, combine meditation, body scans, and gentle movement to help people manage pain, anxiety, and depression. Today, MBSR is offered in hospitals, clinics, and even schools, with studies showing it can reduce chronic pain by up to 50% in some patients. But does it actually work for mental health? The answer is a resounding yes, but with some important caveats. A 2018 study published in JAMA Internal Medicine found that mindfulness-based interventions reduced symptoms of anxiety by 38% and depression by 22% in people with clinical conditions. That's a huge number, but it's not a miracle cure. The effects are often moderate, and they depend on how the practice is taught, how long people stick with it, and even their cultural background. For example, a 2020 study in psychological medicine showed that people who completed an 8-week MBSR program experienced a 30% drop in depressive symptoms compared to those who didn't. But here's the catch: those who practiced consistently and engaged with the material had the best results. What makes mindfulness so powerful? It turns out that the brain is like a muscle, and mindfulness is a kind of mental workout. When you practice paying attention to your breath or noticing sensations in your body, you're training your brain to stay focused and less reactive. Research using brain scans has shown that mindfulness can increase gray matter in areas related to emotional regulation, like the prefrontal cortex, while reducing activity in the amygdala, the part of the brain that triggers the fight-or-flight response. This means that over time, people who practice mindfulness may become better at managing stress and less likely to spiral into negative thought patterns. But here's where things get complicated. Mindfulness isn't a one-size-fits-all solution. Some people find it transformative, while others struggle with it. For example, a 2021 trial in the UK involving 400 adults with mild to moderate depression found that MBCT reduced relapse rates by 31% compared to standard treatment. That's a significant number, but it also means that 70% of people didn't experience that same benefit. Why the difference? Experts say it has to do with how mindfulness is taught, the individual's mindset, and even the severity of their condition. Someone with severe depression might need more intensive support, like medication or therapy, alongside mindfulness. Another important factor is consistency. Just like exercising or learning a language, mindfulness requires regular practice to see real changes. A study from the University of Massachusetts Medical Center, where MBSR was first developed, found that people who practiced daily for at least 30 minutes saw the most improvement in their symptoms. But even short, frequent sessions, like 10 minutes a day, can make a difference. The key is showing up, even when it's hard. And then there's the question of culture. Mindfulness has its roots in Eastern traditions, but when it's introduced in Western contexts, it can sometimes lose its nuance. Some people find the idea of non-judgment confusing or even uncomfortable, especially if they're used to being told to push through pain or suppress emotions. Researchers are now working to make mindfulness more inclusive, adapting techniques to fit different values and beliefs. For example, some programs now incorporate elements of CBT, which is more goal-oriented and structured, to help people who struggle with the more abstract aspects of mindfulness. So what does all this mean for someone who's dealing with anxiety or depression? It means that mindfulness can be a valuable tool, but it's not a replacement for professional help. If you're in a crisis, you should always seek support from a doctor or therapist. However, for many people, adding mindfulness to their treatment plan can provide relief and a sense of control. It's not about eliminating negative thoughts, but learning to observe them without getting pulled into them. The most important takeaway here is that mindfulness is a practice, not a product. It doesn't work the same way for everyone, and it's not a quick fix. But for those who commit to it, the benefits can be profound. Whether you're sitting in a quiet room, walking through a park, or even just taking a few deep breaths during a busy day, you're already on the path to something bigger, a way of being that honors the present moment and opens the door to healing. So the next time you feel overwhelmed by anxiety or stuck in a cycle of depression, remember, you don't have to fix everything right now. You just have to notice what's happening in this moment, and then choose to breathe. That's the power of mindfulness, and it starts with a single, simple act: paying attention to your breath.